These are stories of hope and courage from the hospitals and University of Loma Linda. It's one of the most exotic places on Earth. The Amazon jungle represents over half of the planet's rainforests, spreading across 1.4 billion acres. 1 in 10 known species in the world live in the region, making it the largest collection of living plants and animal species on the planet. But people inhabit the area too. It's said that more than 350 indigenous and ethnic groups live in the Amazon basin, embracing Mother Nature to survive.
O meu nome é Antenor Ravino de Cássia. Eu moro na comunidade de Sobrado.
Antenor works with agriculture, producing many types of crops, including sugarcane, bananas, and pineapples.
Esses que são meus plantios.
3 years ago, he and his family lived in Zhao National Park, where Antenor worked as a tour guide. But a tragic fire burned their house down, killing their 9-year-old and leaving them with nothing. They moved to this region hoping for a better life and a new start. But it's a challenge.
Eu estou passando por uma dificuldade ruim de recursos que eu não tenho. Tem dia que a gente come, tem dia que a gente não come, para poder a gente ver se consegue alguma coisa. Meus filhos todos são pequenos, sou pai de 7 filhos. O maior está com 13 anos. E dá de perceber que a gente com 7 meninos pequenos de menor, no interior desse é difícil. É dura a parada. Então, para mim viver, eu tenho que fazer o que eu estou fazendo. Plantar.
Although the big city may provide more opportunities, it isn't a place where he wants to raise his children.
E meus filhos estão estudando, tem aquela escolinha ali. Para a cidade eu não quero ir. Porque a cidade, principalmente esses municípiozinhos daqui, o menino sai da aula, não tem o que fazer. Vai para a rua, vai aprender o que não presta. Que Deus o livre, daqui uns dias pode até um filho meu estar fumando droga. Então ele aí saiu da aula e vai para a roça comigo, vai aprender a trabalhar. No meu trabalho, vai aprender a trabalhar comigo.
But living in this small village also takes a toll on the Anacasio family. It's a 2-hour boat ride to the nearest town and costs the equivalent of $15 US, more than they can afford unless there's an emergency.
Foi segunda-feira que começou assim, eu estava roçando aqui, ó. Era bem uma hora dessa, assim, estava roçando aí, eu sou muito, bebo muita água. Aí quando foi umas horas me deu uma dor de estômago, vômito, dor de cabeça. Eu fiquei aí sem condições, né? Até eu fui embora para casa, tomei um banho e continuava suando. E essa dor me perturba até hoje. Tudo que eu como dói no meu estômago. E pediu que eu não pegasse mais muito sol, trabalhasse muito assim, tinha que comer alguma coisa.
Many miles away, in a different village called Igarape-Açu, 4-year-old Felipe makes his way to a group of friends in the community. But he's having a difficult time. Felipe loses his breath easily and turns blue because of an undiagnosed heart problem.
O Felipe lá, o jeito dele, todo tempo continua nessa mesma situação, né? Porque ele tem problema de coração, então Gosta, mas só que ele não aguenta. A questão é que ele não aguenta. Ele anda ao máximo 2, 3 metros, ele tem que ficar de corda, porque senão alguma coisa de errado com ele. Então eu seguro muito ele, então ele não é que nem os outros brincam, jogam bola e ele fica sempre parado.
Felipe and his family are one of 35 families who live in this community along the Rio Negro. Tonight, a team of healthcare professionals and students from Loma Linda University is boarding a boat that will take them down the Rio Negro, a tributary of the Amazon River. But will they stop at Antenor and Felipe's villages?
Let's get over here real quick before we leave. We're gonna leave in a little bit, and I will introduce you guys to our crew over here. This is Captain Ed Milton. He's in charge of the boat over here, so if you guys have any questions about the boat, he'll take care of that.
Já são 3 horas da manhã. A viagem daqui até no Vairão são 10 horas de viagem e nós vamos chegar lá por volta de 1 ou 2 horas da tarde, provavelmente. A viagem vai ser bem tranquila e a noite será maravilhosa para navegarmos.
Their trip begins by setting up their sleeping arrangements, hammocks hanging from the top deck of the boat. For the Loma Linda team, it's a 1-week boat trip down the river. Each day they will stop at a different village to set up a health clinic. Since 1998, Loma Linda University has journeyed down the Amazon River on a regular basis. The next afternoon, they reach Novo Airo, where the city mayor and secretary of health tell them which communities need their help. Surprisingly, the team's destinations change from what they had originally planned.
Like when you're on a mission trip, there's 3 things that you need to learn. The first one is adaptability. The second one is very similar to that. It's adaptability. And the third one is very similar to that, adaptability. We weren't supposed to be here today. We were supposed to be in Coari, Lake Mamiá. That was the original plan. A lot of things happened between Thursday, or when I left Loma Linda, and to today. So we end up over here. We don't understand, but that's where we are. So we need to do the best with what we have.
But the change of plans could be good news for Antenor and little Felipe. On the way to their first community, the team prepares healthcare supplies and children's activities. Their first stop is at the village of Bacaba, where they set up a medical clinic, dental clinic, pharmacy, and provide children's activities. The last time a health boat stopped at this village was 9 months ago.
It's really important. These kids and everyone really know the importance of preventing us from having to extract the teeth. So we've been showing them how to brush their teeth, and we'll be giving them oral hygiene tips, like on eating habits and snacking and things like that, to prevent this from happening.
And you have to make sure you get the back teeth too, all the way back there, the very last teeth.
Você tem que ter certeza. Todos os dentes, até o último, lá atrás, ó. Põe o dedo aí pra ver, lá atrás.
So we're putting fluoride on the toothbrushes and teaching them how to brush their teeth.
Are you guys all done?
Not far, the Anacasio family goes to bed wondering what lies ahead of them. With no doctor or pharmacy near them, Antenor is still sick. Little do they know that the Loma Linda health boat is coming their way. Meanwhile, the Loma Linda health team continues visiting other communities along the Rio Negro.
Put it right here.
Muito bem.
sir. Yeah. Whoa!
¿Más agua? Nice! He's got it. He's got it down. He got it.
I put it. Así que-
Toca aqui. Oh my goodness.
2 days later, the Anacasio family awakens to the health boat anchoring along their shore. It's been a whole year since their village last saw a healthcare boat. As soon as the clinic opens, Antenor sees one of the physicians.
Nice to meet you. Aí deu dor de estômago, vômito, dor de cabeça.
And he had a stomach ache and
Aí
he
o rosto amanheceu assim
vomiting
meio inchado.
and like a headache. Dói quando come?
Dói.
Quando o senhor come, dói? It hurts when he's eating.
Can you lay down on just
Deitar.
yeah. Have him breathe.
Respira fundo.
So, the pain after eating is every day this week or just one time?
A dor que o senhor teve foi só todos os dias da semana? Tá doendo desde de quando aconteceu? Ou foi só aquele primeiro dia?
Fica doendo.
Então toda vez que o senhor come, dói agora. O senhor lembra aquele dia? Yeah, it's every day.
Every day? So he might have minor irritation of the stomach this week. The pain while working, I don't think it's his heart. I think maybe he has a stomach irritation. So we can give him a little pill for stomach pain that he can take 1 or 2 weeks.
Yeah. Tenor, que bom, prazer. Tá? O senhor pode levar na farmácia, aí ela dá o remédio, tá?
Olá. Oi.
After his doctor's visit, Antenor picks up his medication from the team's pharmacy that they set up in the village's school. Meanwhile, the rest of his family takes the opportunity to visit the doctors as well. For the youngest son with burn wounds, they advise them to go to Novo Airo in a couple of days, when there will be a larger clinic with more medical equipment and personnel. After the Loma Linda team sees all the patients, they say their farewells and go to the next village. But in the distance, a storm is heading their way.
Chuva. Vem chuva muito rápida e temos que sair para nos guardar. Temos que entrar aqui dentro para ficar guardado, guardar o barco.
The captain alerts the others so they can take safety by docking in a cove. It was just 1 year ago that a mission boat got caught in a storm and sank with 20 people inside. Tragically, a young woman couldn't get out and died. So the crew takes extra precautions as they find a safe place to tie the boat down before the storm hits. About 30 minutes later, the storm dies down, and the team is able to open the clinic at the village.
So you think you can use these?
Você acha que dá pra usar?
Dá,
Yeah.
dá.
Matt wanted to make sure someone got them. Here, let me see if they fit. Okay. Does it feel okay? Comfortable? Yeah?
Tá.
So you think you can use them?
Dá pra usar?
All right. Cool.
Afterwards, they take a mother and her son back home after giving them some much-needed food. According to the locals, the river water this year is the highest it's been in 50 years, making it difficult to catch fish, a primary source of food for many people along the river.
É, porque os passarinhos aqui em casa, no sítio, quando eles estão muito alegres, vai chegar alguém. Aí hoje eu senti, eles estão alegres, eu digo, meu Deus, quem é que vai chegar? Porque hoje minha mãe chega, mas eles estão muito alegres, eles chegam, eles se embolam aqui pra cá, pra lá. Aí quando eu escutei a voadeira vinha zoando, eu disse alguém, aí que eu olhei, eu digo, é o pessoal como é que seria? O barco da saúde. Graças a Deus eu estou muito feliz porque eu recebi meu remédio que eu não tinha dinheiro para comprar. Isso é uma dor muito dolorida que eu sinto. Essa dor já faz muitos anos. Eu nunca fiz, porque o médico pede para fazer exame, mas tem que pagar e os exames são muito caros. Eu não sei que dor é essa que eu sinto no meu estômago. Mas estou muito feliz porque, graças a meu bom Deus, Ele mandou esse remédio para mim. Estou muito satisfeita com a presença de vocês aqui. Que Deus abençoe.
Her son makes a living catching fish at night with a spear and a flashlight run by a car battery. She makes barbecue skewers
Aqui é assim, ó.
and sells 1,000 of them for the equivalent of $1.70.
O dia todinho, se der, a gente faz um milheiro conforme você puder fazer.
The next couple of days, Loma Linda continues its trip. But the weather is the hottest it has been so far this week, posing a problem for the Loma Linda team. Dehydration and exhaustion set in.
I think it was dehydration. I wasn't drinking enough water and running around because my water was warm, which is a big mistake. Should have drank it anyway. And so I started with a headache, got dizzy, and then all went downhill from there.
Inside the community school, Rachel injures her ankle while playing with the kids.
I inverted my foot, and so you can see it's kind of swollen now. I'm not sure if it's broken or not.
Because of the injured and sick healthcare members, they decide to play it safe and go to the hospital, about a 3-hour boat ride away.
As soon as we come back from the hospital, we're gonna go to the village and do the same thing we did last night. We're gonna try to arrive, it's not far from here, we're gonna try to arrive at the village and then tell everyone that we're gonna have a clinic tomorrow morning, so tomorrow morning everything's prepared and we'll be ready and set to go tomorrow morning.
Oh, there we got it.
An ambulance is already at port to transport them to the hospital. That same night, little Felipe is asleep in his hammock. His parents have no resources to get their son help for his heart condition. But because Loma Linda made a change of plans midway in their trip, they're even closer to his village. Doctors hook up an IV to Jaritza and assess Rachel's ankle.
He's gonna push a little, let him know if it's hurting. It's fine. Yeah, hurts? Yeah, tá doendo. Hurts? Hurts? That area?
Atadura de crepe.
A couple days she should be walking fine again.
The next day, the boat anchors at Igarape Asu. Upon their arrival, Felipe's dad prepares to take his son to the clinic right when it opens. He hands the doctor Felipe's EKG that was taken from a hospital in Manaus a few months ago.
He does have a hole in his heart. But the problem is that we don't know if, without doing an ultrasound, if only the hole in it is the only problem, or there's something else with the vessels that go into the heart. Okay. This is the heart is divided in 4 different places because of the hole here. These 2 areas have to work too much.
Porque aquelas 2 áreas, elas têm que trabalhar muito mais para compensar.
His color, he gets tired because the blood that is sent from here to the lungs.
Ele fica cansado porque o sangue que teria que ir dali pro pulmão.
Okay, doesn't have oxygen.
Não tem oxigênio.
Okay.
Então por isso que ele fica com essa.
So that's why his color here is not good.
Por isso que a coloração do dedinho dele.
Because blood without oxygen looks more blue.
They advised Felipe's parents to go to the hospital in Novo Airo the following Sunday so that the Loma Linda team can check his heart with an ultrasound. 2 days later, they make it to the special clinic at the hospital.
Very good. The hole is this big old part that should be closed completely.
Dr. De La Cruz determines that he has a condition called tetralogy of Fallot. Felipe should have had surgery years ago.
Yep.
Muy bien, muy bien.
The Anacasio family is also there so that his son can see a specialist for his burns. Antenor says he's feeling better thanks to the medication.
Obrigada em nome de cada criança que foi atendida hoje.
Thank you in the name of every child that was
E obrigada em nome de toda a população de Novo Airão.
and thank you in the name of all the population of Novo Airão.
Muito obrigada.
Thank you.
It's time for Loma Linda to head back home to Southern California. But they won't forget about Felipe's life-threatening case. Back at Loma Linda, the search was on to try to find a hospital and physician who could perform the surgery. After 6 months, they finally find a hospital in São Paulo, Brazil. The director of the Loma Linda University Amazon mission trip flies back to Brazil to pick up Felipe and his dad for the flight to the big city.
A lot of times when you come over here, there's a lot of groups that will come and tell like, oh, okay, we'll help you out. And then it's so easy to go back home and forget about the people that you saw over here, the needs that they need. You know, I'm glad that through Loma Linda we're able to come back here and provide, you know, the surgery that he needs over in São Paulo.
Sabe o que eu sinto aqui no coração? Sabe? O que o Dr. Luiz passou a informação para mim que se ele não fizesse a cirurgia, ele, a hora momento eu podia perder ele. Ele podia morrer rápido de coração, que a gente sempre ficou controlando ele, sempre ficou lutando lá dentro para ele.
Como é que você tá? Hã? Cadê o braço do tio? Hã? Bom dia, velho. E aí? Tudo bem? Como é que tá, Francisco? Tudo bom?
Felipe and his family are packed and ready to go. His mother and little brother will stay with family in the city, Manaus, while Felipe takes his first airplane ride.
You know, it's easy to sit back and say sorry for a situation like Felipe's, you know. But when you see that you can actually make a difference, it's impossible to just, you know, sit back and not do something. That's why we're here, you know, trying to make a difference.
Através do amigo, né? Através da amiga que está aí também, que a gente está chegando aqui em São Paulo para junto com vocês para resolver o problema dele, né?
It's been a roller coaster with emotions, you know, trying to see what everything is happening with Felipe, and so yeah, I'm scared and I don't know what's going to happen.
Doctors inform his father that the operation is very risky. After hours in the operating room, the doctor tells Francisco that Felipe did very well. But the next morning, everything changes. His vitals weaken, and Felipe unexpectedly passes away.
A gente tivesse logo descobrido, que o doutor falou, ele tinha mais. Por isso eu estou muito feliz, porque eles ajudaram a gente. Já sabia, né? Não tinha mais muito tempo de vida. Se eu não tivesse ido, ele ia morrer sempre, não tinha jeito, né? Então eu estou muito feliz. Eu e ela estamos muito felizes por Deus ter tirado ele. Hoje eu sei que está no céu, está mais tranquilo que eu.
Thank you for joining us.